All right, everyone. Welcome to Revolutionary Health, a program of the Counter Narrative Project. I'm joined with.
David Malebranche, how y'all doing?
So, this is our second time doing this. So, we're still learning the process. So, before we get started, we want to give a few seconds for folks to join us and kind of come into the conversation. Also, if you have a second, please like the video. That'll help us you know, generate people being able to see it. So yeah, this is exciting.
Mm-hmm.
Okay. All right. Why don't we just jump in? Oh, can you hear my voice?
Put on mute.
All right. So last week we had the opportunity to talk about a number of topics. We talked about hepatitis C. We talked about crabs. We talked about a lot of different
Vitamins. Yeah.
topics. Um, but I wanted to, and I felt like this was kind of in the comments too. And I've also heard about this a lot. And I know we talked about this before we went live, which is about, and this kind of takes us in a slightly different direction. But David, would you mind talking a little bit about what doctors and really clinicians in general, what they should know about how racism impacts our health? What should they know?
Yeah, I think it's a good question. I don't think it gets explored enough, the impact of racism on our health. I think people sometimes do it in indirect ways. So they'll talk about how racism influences our behaviors, our mental health, and then how we make decisions about our health. And so that kind of escapes the direct influence of racism. And
Yes.
I don't think much has been done, which as far as racism and say microaggressions, which to the audience are kind of like small little racial insults and things that happen, like a white woman grabbing her purse when you get in the elevator, a cop pulling you over just because, someone at a store following you around as you're just shopping for something. These kind of things can happen. And eventually how that impacts the immune system or our stress hormones over time, and how that kind of increases rates of inflammation in our body, may precipitate hypertension, may precipitate things like early stroke, early cardiovascular disease. And I think there's been a lot of research about coping. There was a Duke professor who actually developed a scale called the John Henryism scale. And the story about John Henry being the steel driving man, a lot of people know the song, but John Henry, when people used to actually build train tunnels through mountains, and it used to be man-made, and then they found a steel driver that could go through and do it better than men. And John Henry said, no, I can actually, the myth goes that John Henry said, no, I can do it better than the steel driver, than the machine. So he actually tunneled his way through the mountain, which was great. And he beat the steel driver, but unfortunately at the end, he collapsed and died of heart exhaustion. And so it's an interesting story and a myth to talk about, in that our response to these kind of things happening is to overcome, is to cope, is to do some other things, and how
to be resilient, right?
To be resilient, yeah. And so people talk about resilience in a good way.
Yes.
But we don't talk about how resilience and pushing through all these microaggressions, pushing through racism actually gets us to the point where there's a lot of inflammation, there's a lot of stress on our heart. And there was actually an interesting study years ago, this is like 15, 20 years ago, and I'm quite certain they've done replicants of this, but they actually tracked through the diaspora when you come from, I'm trying to think of where the audience is looking, if you come from West Africa here and then going through the Caribbean and then to the United States, and they measured measured blood pressure readings for Black folks in West Africa, and then in the Caribbean, and then in the United States. And what do you think they found?
What did they find?
Yeah, like this. What did they find? So basically what they found was their blood pressure was normal in West Africa. And then as you went across the diaspora to the United States, it increased incrementally. And so the conclusion was that there was something about this transition to the United States, and whether it be racism, whether it be stress, whether it be environmental changes in diet, other things, but more environmental factors that are at play with high blood pressure, rather than just saying Black people are more likely to get high blood pressure. Like, it's got to be deeper than that. So when you ask a question about racism, like it's a complicated and in-depth thing that a lot of people don't actually do as much research on as should be done.
All right. Hey, Art Jackson, I see you. In peace and blessings to you as well. Also, you guys, please feel free to ask questions in the comments. Me and David have had this ongoing discussion about whether or not people will be mad at us if we don't get to everybody's question. But I believe that y'all are going to be really patient and really understanding when not able to get to everybody's question.
Right.
So we're going to just see how that goes. But thank you for sharing about. And what I also appreciate about what you shared is that, I think we've come a long way. So got longer to go.
Right.
With understanding the ways that racism and homophobia and other forms of structural violence are barriers to healthcare.
Mm-hmm.
But what you're talking about is not only how it's how those things, especially racism, functions as a barrier to healthcare. Absolutely. You're talking about how racism impacts our actual health.
Yeah.
And I think that's what's really powerful.
Yeah, it is powerful because I think we do a lot of talking, whether people want to acknowledge it or admit it or not, how racism works on these different structural levels with policies and medical institutions, in educational systems, in the school to prison pipeline and incarceration and politics. These are things that we know that racism plays a role every day, but looking at it on the individual level and saying like, well, okay, how does it affect me as an individual? How does it affect myself as an individual? Is something that, we don't study enough. I think because we don't want to acknowledge either that we don't know the mechanisms by which racism influences stress hormones, our immune system, or we just want to say, well, we just have to react to it better. So don't let that racism bother you. Just persevere, just overcome, just deal with the stress and be resilient. And how can we be more resilient? It's like, no, well, how can we erase this problem that's causing our adverse health outcomes on many levels?
And when we talk about resilience, I mean, I find, and this is just my opinion, very often we mean people that assimilate in a way. Mm-hmm. Like the good Negro, right? So it's like, you do as you're told,
right?
And I think often, I don't think it's fair to expect people and I also think that the notion of resilience doesn't always put much responsibility on institutions or organizations.
Absolutely.
So it's all the responsibilities on us to navigate these institutions and be resilient and fight harder and be twice as good and all that. And obviously that's a reality that we have to endure, but it doesn't, I don't think, hold institutions or organizations responsible. Related to that, we have a question.
Yeah.
What are your thoughts on how we redefine our approach to community-based organizations that are still white-run, but using Black folks to do the work, but they still make the decisions and the directions that keep them in power? That's
a great question.
That's a great question. Yeah.
We could both wax poetic about that one. Yeah, I think that's been a problem for a long period of time. That continues to be a problem, where you have kind of white-run organizations that hire Black people to be quote unquote key informants, interviewers, recruiters, and then don't invest in the employees that they hire or the volunteers or the interns to kind of further their own careers, to say, hey, why don't you guys apply to school? Why don't you do this? Why don't we put you on this paper or put you on this abstract or let you lead this research? That becomes a problem. But and that still does exist. And as far as solutions to it, I see a lot of solutions recently from different based organizations. And I mean, you're looking at one of them right now, as far as like Charles starting.
I did not tell him to say that.
I know he didn't tell me to say that, but like the Counter Narrative Project is something that is organically Black owned and created. And funding sources can be different, but as long as we know that you're kind of pulling the strings and you're doing what's in charge and you're making the ultimate decisions, that's the good thing. You look at other organizations, Thrive SS with Daniel Driffin. He started that out of his own personal experiences and then gets to do that. So, and there's a lot of things that are happening. I was just meeting with Daniel about like some of his study results, studies he conducted out of Thrive. And it's obvious to me that not only can these organizations, when they're started by us, they can be a sense of community, affirmation, empowerment in and of itself, but they can also be areas where we trust each other. And if we want to conduct some research or do an assessment or do a qualitative study and kind of get the pulse of where we're at, like it's the best place to do it. And you can recruit so many more people if it's coming from a space that is community grown and bred than someplace that like just gets funding to work with Black MSM or Black gay men or Black women, and then doesn't really have the community's best interest in mind, but it's just trying to make say promotions or get a publication.
All you get is a $20 gift card.
Right, or $20 gift card, all that kind of stuff.
And what I appreciate about that, David, is that you're essentially countering the narrative, if you will,
absolutely,
about what's considered community-based research, and it just is very, And I agree. Like I think that there are organizations, there are folks that absolutely we can do research.
Absolutely.
But I see us joined by some folks. Devin Hersey.
Right.
Hey there, Brian. Brian Jones.
Hey.
Hey Jamel Hillard Wallace.
Hey Jamel. Hey, what's up?
And also y'all, again, feel free to ask questions. Daniel just represented. Hey did. Daniel Griffin. Trust between each agency is needed, and let me just speak on that a little bit.
Yeah.
One of the things that it's so easy for us as Black gay organizations to not trust each other.
Right.
It's so easy for us to work against each other.
Right.
And I think, if I'm to be honest, there are so many examples of that in our movement history where organizations have been pitted against each other for a little bit of money.
Right.
And what ends up happening is that, our organizations end up being unhealthy. Our communities end up, like, I think that contributes to healthy communities need healthy community-based organizations, right? Mm-hmm. And I think part of getting to that is having good relationships and having ongoing communication and partnering and working together and having trust. And it doesn't happen overnight. No. But I feel like we have so much at stake. And I'm a firm believer in working beyond, the dominant culture wins when we're working against each other.
When we're picking against each other. Yeah, and I think a lot of times what we have is like organizations, and we allow other people from the external world to kind of influence and say, well, someone's already doing that. You don't need to do that. Or so-and-so's doing this already, or so-and-so is trying to get this stuff. So we're all kind of scrambling to get this same pot of money. We're all scrambling to get the most sexual health questionnaires or HIV tests or HIV test positive.
Exactly.
And we're scrambling. And just to make HIV as an example, but it happens in other kind of health-related fields as well. But the thing is that there's enough room at the table for all of us. And so you can support an organization in New York, can support an organization in Atlanta. A Black gay man living in Atlanta's experience is going to be much different from someone living in New York City or living in Dallas, Texas, or San Francisco, California. And so there's room enough for all of us to tell our narratives and do what we need to do and collaborate and work together. Without that, because you're right, because I think when we start to pit ourselves against each other, not only do the organizations suffer, but then the goals of what we're set on this earth to do, which is to help uplift ourselves and get our collective and community health improved, that's going to suffer as well.
That's related to another question I wanted to ask you, which is, there are many of us that work in organizations that make us unhealthy.
Right.
We go to work or go to school in places that impact our health negatively. And many times we do it because we don't have a choice. We need, we need to work, we need to go to school.
Right.
I've seen, I think, a few think pieces written by particularly young Black gay men about just their experiences working in aid service organizations and community-based organizations, and how those organizations are making them sick, literally.
Right, physically, yeah.
Physically. And I was wondering, David, what advice do you have? How do we, let's say someone's working in an institution and they're feeling, and it's impacting them. Like, how can we stay healthy? How do we stay intact? And I'm intentionally not using the word resilient, but how do we stay intact? How do we stay healthy for those of us that are working in organizations where our work, the place that we work, or the place that we go to school, or the place that is making us physically sick?
Yeah, it's hard because I bet you could tell stories. I could tell stories that I've worked for companies and institutions where I didn't necessarily feel valued. I didn't necessarily feel affirmed. I didn't think that anyone was recognizing the work that I was doing. Yeah. I felt that institutions on the outside were more appreciative of what I did than the home institution that was, paying my monthly bills and helping me pay my monthly bills. And so, sometimes you do have to just drop the mic and leave. And I don't recommend that for everybody, because you can't always it's a certain amount of privilege that you can come in, whether financially or support wise, that you can afford to just drop the mic and leave. I usually tell people, the best thing to do is start to bring it up, like start to have a conversation with your supervisor, with someone that's your leader, with yourself, to figure out what the problems are, and then kind of think of solutions that you can bring to the table. So I think a lot of times we tend to complain about shit. And so we'll say, well, I don't like this because this, that, and the other. This is making me sick. This, and the other. But unless you propose solutions, I think a lot of employers, especially non-Black employers, will just see you as a complainer.
Yeah.
And so they'll probably look at you and be like, oh, well, he or she just complained about so and so and so and so. If you come to the table and try to propose some solutions, it's not a guarantee, but they may say, okay, you have some solutions. And then at that point, if they turn on you and say, nah, just kind of suck it up and keep picking cotton or keep doing this, do whatever. You know what I'm saying? Like if they kind of approach it like that, that's the point where you have to say, okay, I need to work something on my own. And this is the hard part of it, because it does take a lot of resiliency. It does take a lot of self-determination, and it takes a lot of hard work. Like, you can't go home, which I've been guilty of sometimes, and you just prop your feet up and you're so tired you do whatever.
Veg out.
Yeah, and veg out. The people that are able to disentangle themselves from those toxic jobs, when you ask them their narratives, what they have done is, like, after they get out of the 9 to 5, they go straight to do whatever other work they want to do. Or they're sitting in Starbucks for 4 or 5 hours trying to craft a project on their computer about what they want to do, or they're networking with someone with the organization, or they're volunteering. They're doing something to kind of get this stuff created so that when they're ready to leave that job, they'll have a soft landing. And so I think there are a number of ways to do it. It just depends on the situation. But I would tell the viewers out there, and just anyone else who is listening, like, if you are in a job that's like toxic and emotionally draining you, draining your soul, draining your mental energy, draining your physical energy, you can get out, and you have to kind of start looking for ways to get out, because life is short. And you see a lot of us, like, people disappear. Again, I use the example of the brother that disappeared from the CDC. Like, we don't know what was going on with him. We don't know what was happening with him at work. But that narrative of, like, I didn't get the promotion. I trained this young white girl, and then she became my supervisor. And then she started telling me what to do, and she's 10 years younger than me. Like, that story happens all the time in all different related fields to a lot of Black gay men out there. Not to mention a lot of Black straight men, a lot of Black women, a lot of Latino. Like, it happens to a lot of us. So
absolutely,
those stories, like, you have to figure out what to do in that situation. When it starts to impact your physical health, or your mental health, that's when it's time to make a decision, start to move on.
I see Yolo has joined us. Hey, Yolo.
Hey, Yolo.
And Abraham Johnson. Hey. I'll just share a little bit about my experience and some stuff that I found working for me. When I worked at a place, and I won't say the name, but when things started to make me feel like unhealthy, when it started to feel unhealthy for me, I mean, I would do stuff like, I remember I would write these quotes on my little whiteboard, because it helped me remember why I was there, and it helped give me perspective. So even though it was hard and it was painful, like, I would look over at my whiteboard and see, the Joseph Beam quote, Black men loving Black men is Revolutionary Act, or I would see, Essex Hemphill quotes, or, Craig Harris quotes, and it would just really, it would help. And again, it wasn't like a perfect solution, but I needed to see things that affirmed me, and that made me feel valuable, especially since I was, being in institutions that made me feel very small. So that was part of it. Another thing that I started to do, and I always tell this story, there was another Black gay employee, so it was 2 of us. And at a certain point, I think we both developed narratives around each other. And it became one of those things where I think we just started sort of assuming that we didn't like it. That's how the institutional violence works. Like, it makes you see enemies among your own. Sometimes it's real, but sometimes it's not. And I was just like, and at a certain point, I was like, why do I think this man, like, why do we have beef? Like, what is that really about? And I realized that there was a narrative about him, there was a narrative about me, and the institution was kind of turning us against each other. And one day, I mean, I was like, let's just have, I invited him out to dinner, and we had dinner, and we talked, and I realized a lot of stuff I was going through, he was going through, and I was like, oh God, we're going through some of the same stuff. Because I always thought that I had it hard, and nobody else had it as hard as me, and nobody else went through the same stuff, and nobody else was being questioned, and he had the same thing. And so he became an amazing support system, and we're able to be like a sounding board, and it's so important. So I would say just having, a good support system, having good comrades, people that you can confide in, I think is really important in navigating institutions, and it made me feel so much better. And finally, I ended up setting boundaries. So I was like, I'm gonna put up with this, but these are my boundaries. So these are my non-negotiables. So if this happens, I'm out. So I had a sense of like what my boundaries are and what I, even though it was hard, and I also had an exit date. I was like, I'm gonna do this now, but this is my exit date, and so those are some of the things. But again, I think every situation is different. Certainly I don't want to, I was in a situation where I couldn't quit my job. Like there just wasn't an option for me. And I had to sort of be in it. But David, to pivot, again, y'all, feel free to ask questions, comment, in the comments, feel free to ask questions. I think very often, and I don't want to talk too much specifically about sexual health, But I wanted to talk about ask one more thing about sexual health, or I guess it's actually related to general health. My take, and this is just my opinion, so don't get mad at me, but this is just my opinion. I feel like my experience has been, and there could be other examples, but I just feel like there are like so many examples I've seen where Black culture and Black gay culture specifically is seen as like pathological in public health. Sometimes it's explicit, sometimes it's subtle. David, could you talk a bit about how culture can be part of our healing? Like, what are some ways that we can draw from culture, Black culture, maybe even like Black gay culture? What are some ways we can draw from our culture as a source of healing?
Yeah, I think that's a great point. We always get told the narrative around, narrative particularly around Black gay men is all about HIV. It's about how we hate ourselves, about how we're predators and child molesters and all these other things.
Absolutely.
And we don't get kind of the affirming things. I think there's a lot in Black gay culture that we can see if we just reach out and start to try to investigate some of the history. And I think, a lot of people dog millennials and say millennials don't know their history, but like Generation X.
I didn't say that.
My generation, you didn't say that, but a lot of people do. But like even baby boomers, like, don't know all their history about like who was Langston Hughes, who was, James Baldwin, who was Essex Hemphill, who was Ray Busted. Like these are all, Black gay heroes and Black gay cultural icons that we can kind of rest on.
Yes.
And so we can kind of at the end of the day say, who are these people that came before us? What did they do? What mark did they leave on American culture, Black gay culture? And whether they acknowledge themselves as gay or not, I think is kind of irrelevant. I think being able to see ourselves and kind of visualize ourselves and what we do. And then I also think a part of it is about creating the own culture ourselves. So doing your own thing. And so putting yourself out there like that and kind of becoming part of the culture that you want to see. So if you don't see enough of us out here talking about these certain things, or if you're a hair designer, say, I haven't seen many Black hair designers kind of doing stuff, then create a YouTube channel. Or I haven't seen many accountants doing like financial health. Create that history. And so I'm a big proponent of like learning some of the static history and drawing from the culture that's there in front of us right now and in the past, but also about like doing things to kind of create our own culture, because I think that fosters a lot of resiliency for us.
I mean, and I think that that's really powerful because, we're handed so many images and narratives that are really painful. Even on social media, like I know I have to really filter my social media because it's like you're constantly, there's so many images and there's a lot of negativity. So it's like being able to create an environment. And it's not to say you're trying to like isolate yourself or live in a bubble because that's just not realistic. But at the same time, being able to find within the culture things that affirm you, things that feel good, things that bring you joy.
Right. And sometimes we often do get isolated and live in our own bubble, and we'll think, well, I'm the only one going through this, or this is just me, or there's nothing out here to kind of appeal to me. And you kind of sell yourself short in that no one wants to hear your story. No one wants to hear my story. And that if we wrote a story about ourselves, or we did a video or produced a documentary, that no one would watch it. And that's complete bullshit, because there are so many people out there that are actually waiting for something like that to come out. So if we're all sitting around waiting for someone else to, create something or put something out there, we'll be waiting a long period of time. And that's the thing that happens. Like people at a certain point in time we have to be the ones to create our own. Again, it's about the narrative. Like we have to be the ones to create our own narrative. Otherwise, we're kind of getting rolled over by these media buses that are just trampling over us with these narratives that aren't necessarily untrue, but they're very one-sided in the way they portray like a lot of pathology. So
absolutely. I know we've covered a lot of ground.
Are we almost done? Oh, wow, we are close.
I know, it goes so fast.
It's a half hour, right?
As always, David, I'm always thinking about like just general tips we can give to people about like taking care of themselves. One of the things I found myself asking a lot is just like, how are you doing self-care? Like, what does self-care look like? Because I think so many of us are under so much stress, and there's just so much going on in the world right now.
Yeah.
Do you have any just general tips about like how folks can just manage stress?
I don't know about general. I can kind of give an anecdote of something that's kind of going on like right now. Yeah. So, like for me, I do so much for work, and I consider myself a healer and a giver. And I tend to become an introvert and kind of like I become a recluse at certain times. And I think there are a lot of us that are out there that are doing a lot of stuff for our families, for our friends, for everything else. And sometimes I shut myself off. And like within the past, few months, I've been able to like adopt a gay nephew.
Really?
That, well, not like officially adopt, but like have somebody come into my life who is like a family member. He's a nephew. He lives with me from time to time, and we spend a lot of time. And it really is like helped open me up with a lot of things. As a brother came in from out of town, who's originally from Haiti, but is doing some work in New York right now, who came by. And then a friend of mine who was in need on Friday was going through some trouble, and he came by and like stayed over for a couple of days. And it was interesting because at first I got really stressed out because my attitude was like, oh my God, I'm an introvert. I love my own space. I love being by myself. Like all these people in the house, it's like,
I too know that
my head,
being an introvert.
Yeah, my head was about to explode. But then as I started to see it, like we sat down and we were watching movies. We've been cooking for each other and like doing different things. And it turned out like it wasn't as bad as I thought it was going to be. And so I guess when you ask me the question of, how do we deal with stress? I think when I look at my personal example, sometimes I run from it, or sometimes I put myself under a shell like a turtle and just kind of ignore it. But I think there are moments where people who will be asking you for help or coming to you for help, you think you're giving them help, but they're actually the ones that are helping you. And so you think that it's just that one-sided thing, and like, and on some different circumstances, it may look like you're the one who's giving, you're the one that's helping out. But in reality, there's such a reciprocal process going on here, and both lanes are open. And so you thought you didn't need help, but you're like, oh my God, oh shit, I had really cut myself off. Oh shit, I had, kind of closed my heart off to this, that, and the other. Oh my God, I'm not being the person that I know I am. And sometimes it takes other people to come into your life to kind of open that back up. So just being open to new experiences. We were talking about this just a second ago with Alvin, but like opening yourself up to new things that may happen, even though you may want to fight it at the beginning.
I know, change is hard, right?
Change is hard.
But I definitely believe that there can be just a really tremendous growth that can happen sometimes when you make yourself uncomfortable, when you have new experiences. And it's really about like, life is so short, and I just think that it's so important to collect experiences and really just have meaningful experiences.
Right. Have you done that, like making yourself uncomfortable?
Oh yeah.
What's
like
a
this,
good
right?
example of that? Right. You're like, this right here, right now is the big example, right?
Oh my God, I hate being on TV, but nonetheless,
right.
But I was like, it's an opportunity, right?
Mm-hmm.
And we're always growing,
right?
But yeah, again, y'all, please let us know what you think in the comments. Feel free to email us. Join our email list actually at thecounternarrative.org. If you have questions that you want us to see us respond to for next week, Tuesday at 7:00, feel free to email us. Facebook me, email me. Don't email David. Leave David alone.
Yeah.
If David has enough going on.
Well, also, if you think of any topics that you think would be interesting, I think one of the fears we talked about this was that if we start with a certain topic, there's going to be people who aren't going to be interested and may tune out. And so we want to be able to address topics within the Black, gay, and same gender loving community.
Hey Ed, hey Richard,
hey everybody, to impact us and kind of things you may want to hear more about, and then we can kind of focus some of our things on this. But we want this to kind of be a free flowing exercise where you guys can feel like you can walk in, you see us on Facebook Live, you say, hey, I have a health related question. Is that, as you can see from the discussion today, we don't have to talk about specifically high blood pressure or diabetes or asthma or HIV. We can talk about right. We don't have to talk about that, but if you want to, we can. But if you want to talk about other things, about racism, about homophobia, about shame and stigma, tops and bottoms, we can talk about all this.
Can I have one more question? Because I forgot last week, and because we're inclusive,
right?
It's important inclusive. So you gave some so I asked you the question, or somebody asked a question about advice you had for people bottoming,
right?
So I was wondering, for our final, could you give some advice to people that want to top? Or
as far as
just like what advice? So somebody wants to, are there ways to prepare? Are there things that you don't know?
I don't know. I think it's more complicated for bottoms than it is for tops.
Is it? I don't know. Is that,
you don't think so?
I
don't know whether that's an assumption or not. And I'd love to hear from the audience what they think about that. If they do think like, the way bottoms you prepare when you're bottoming is different than when you prepare when you're topping.
So like one of the things that I hear, for example, is that even stuff like hygiene, like I think a lot of times in our community we associate hygiene with bottoming, but you know, you will hear folks talk about
top hygiene, like clean your dick, wash your balls. If you're uncircumcised, that's an example, but that may not be an example.
Theoretically, yeah, because I mean, yeah.
Some people like must, some people like natural smell, some people like a lot of other things, right? So, you know, we just kind of depend. So, you know, a lot of people do different things. You're right. We can't make assumptions. But, I mean, I'd be interested to hear.
Is it like a checklist, though?
I don't know if there's a checklist, but I'd like to think that the audience may know some other things that they want to talk about with regards to that. If they do think it's a preparation.
Okay, because I imagine that if you've never talked before.
Right.
I mean, I guess the assumption is that it's just
stick it in.
Yeah, but is that really like?
No, I mean, there's gonna be things about how you stroke, how you move, what positions you get in, what may be easier, what may be not. If you're bigger in girth than if you're smaller in girth, and what you may need to do in those kind of situations. So I think you're right. There is some preparation. Maybe we can delve into it a little bit deeper next week.
Okay. I'll try to get you to because I know last week we talked about tips for people, the receptive partner, but I thought to be fair we should.
No, I think that's a good point.
Yeah. But maybe next week.
Yeah, maybe next week would be good. But it's a good point because there's a lot more about bottoms out there as far as like preparation for anal sex than there are for tops.
Yeah.
But I don't want to be
people that top.
I don't want us. Yeah, it's true. People who top. I don't want us to top shame. Like, you know,
there's no top shame,
or top stigma, or anything like that.
Shaming, no judgment in general. Oh my God, we're gonna get crazy emails.
Right.
All right, everyone. Again, please, we're gonna load this video onto YouTube, so definitely check us out on YouTube. Like or subscribe to our YouTube channel. It's the youtube.com/counternarrative or something like that. Please join our email list if you haven't at thecounternarrative.org. If you haven't, also please make sure that you like the Counter Narrative on Facebook. So follow us on all our social media. As I shared, we talked about this. We're going to be doing this every Tuesday at 7. Mm-hmm. If you have ideas for again topics you want to see, David's really the expert. See David cover. We'll do that. And just thank you for checking us out. I hope I said hey to everybody.
Ooh, can I tell them that we do plan on...
Oh, hey, Damien. Damien's here.
Hey, Damien. And I want to tell everybody that we do plan on bringing in other experts. And so it won't be me all the time answering questions.
All the time.
Yeah, exactly. So we want to make this an open thing. So if you are interested and if you have a level of expertise on a health topic or in a health area that you may want to be involved with, email Charles. And hit Charles up so we can actually start to gain from the community, because I think the main thing is kind of garnering our own resources so that we can be the solutions to our own issues.
Oh, it has a good topic. Good sex without anal penetration. Maybe we'll cover that next week.
Yes, Lord, yes.
Yeah, exactly, right. Because this has been a very penetrative centric discussion.
You're stigmatizing against foreplay. I don't like that.
Well, I mean, people, the oral community would also argue that their sex isn't just foreplay, that post-penetrative sex is also a form of sex too. Hey Dante, hey Nathan, got a thanks from Nathan. So yeah, love y'all. Please check us out every Tuesday at 7. Alvin's giving me the look like, wrap it up, Charles.
Oh, we gotta wrap it up.
All right, thanks so much.
Bye, y'all.
Bye.